Hello, Dr. Fenn. There she is. How are
Hi
you?
there.
Hi.
I'm well. How are you?
I'm very well. A pleasure to meet with you here. Thank you for joining us in the
Oh, my
Perry
pleasure.
community. This is just a joy. So just to kind of quickly give you a sense of the lay of the land, some people may pop in questions and comments in the chat. I'm happy to facilitate those for you so that you don't have to sort of worry about reading them yourself. And we will just get started. Welcome, Dr. Annie Fenn of Brain Health Kitchen and the book of the same name. Dr. Annie Fenn is the founder of Brain Health Kitchen, the only cooking school of its kind focused exclusively on brain health and helping people prevent cognitive decline through food and lifestyle. After 20 years as a board-certified OBGYN, she traded in her stethoscope for an apron to pursue her passion for the culinary arts. But it was your mother's diagnosis with dementia that helped Dr. Fenn find her path and her new calling, one that enabled her to not only help her mother, who I love seeing images of in your feed, but also create significant and meaningful impact for others. Dr. Fenn, welcome again to the Perry community. Thank you for being here. Your book, Brain Health Kitchen, is beautiful. And the recipes that I've tried are delicious and lovely and easy, which is really nice.
Easy is important.
Easy is really important. And I love that you pivoted from practice as an OB/GYN to a practice in culinary medicine, really. I don't know if you refer to it that way, but that's sort of how I like to think of it. And I know the pivot was particularly poignant for you and perhaps tough, and I wanted to just allow you to open up with a bit or as much about that story as you would like.
Oh, of course. And thank you for having me. It's such a pleasure to be on your platform. I love everything you're doing in the menopause space. As you mentioned, I was specializing in menopause for a long time. And this was back when menopause was not getting the kind of attention it's getting now.
Yes.
Thanks to a lot of the work at Perry and of some other people. So I think what happened with me in terms of transitioning from being an OB/GYN doctor to someone who, is a chef and talks about, culinary medicine, things like that. I was just really following a certain passion that I felt like I needed to explore. I was 20 years into my private practice. I was super busy. I loved my patients dearly. I had delivered a lot of the babies in my area.
Yes.
And I was really loving working with menopausal and perimenopausal women. But, something in my brain just wanted to do something different. And I had, when you become a doctor, at least in my situation, I went straight from high school to college. I finished college early. I went straight into medical school. I had 1 week off between medical school and residency. Then I went straight into my private practice. I was living and breathing medicine for many, many years. But at some point, and I was around 45 when this happened, I just really was craving to do something different with my brain. And this idea kept coming up and it wouldn't go away, was that I wanted to go to culinary school. And I didn't even have any plans with that. I just wanted to immerse myself in the world of food because I'd always been a cook and I'd always been passionate about healthy cooking. I'd always counseled my patients about healthy eating. And I just really wanted to do that. So at some point, I just made the decision to do it. And that's what I did. And after I retired from medicine, I got some training. I didn't go to, like a typical culinary school. I was still raising children. I had kids at home. But I did travel for about a month every summer. And I studied in central Mexico in Tepoztlan, where they have a very healthy, vegetable-forward cuisine outside of Oaxaca. I studied in Tuscany. I traveled around Sicily. I went to the Culinary Institute of America in San Antonio, Texas, and just got some culinary chops. And then when I came back, I wasn't sure what I was going to do with it. I had been writing about food. I had a food blog where I shared recipes. But I just started teaching people how to cook with healthy foods, because I felt like even in OBGYN, a lot of the things that I was seeing people for and doing surgery for and taking care of complications of pregnancy for, the root cause was, maybe not so good nutrition. And also, people should be following a healthier lifestyle. I felt like these nutrition and lifestyle pieces were the most important root causes of a lot of the problems I saw.
Can I hover there for a moment before we dive into Alzheimer's? I think what this is so important. We talk about, all of us kind of in this midlife, menopausal, perimenopausal niche, if you will, are talking about things, as you say, you've been talking about for many, many years now. And there are things that we can control to the best of our ability, and things perhaps that we can't. And to the best of our ability, when we're aware and if we're able, we can focus on nutrition more, we can focus on movement more. But I'm also sort of thinking about chronic disease and what we may be able to stave off just from what we consume. And so when you talk about the root cause of things that you saw in your practice, what were you seeing that nutrition might have had a better hand in?
Well, in women having babies, for sure, who ended up having C-sections, or women who had surgeries for other gynecological conditions, wound healing is very much dependent on, good nutrition. And so I was noticing that people with poor nutrition just weren't doing so well after surgery. They were having a harder time and their wounds weren't healing as well. We know in obstetrics that nutrition is really important for healthy mom, healthy baby, of course, but we were seeing more complications of pregnancy secondary to poor nutrition, things like preterm labor, which we now know, fast forward, 10, 15 years, we now know that there are, definitely links to nutrition, and good nutrition is really part of the, the prenatal care. Back then, there just wasn't a lot of science behind it. And then you get into things like infertility and polycystic ovary disease, which is a metabolic disruption that can be treated with drugs, but it can also be treated with nutrition and exercise. So there's a whole list of things, even before you get to menopause, that are linked to good quality lifestyle factors. And then when you get into menopause, when I was practicing menopause, I was the only certified menopause educator in my region, which
and you
was
were in Wyoming,
Montana, Idaho, and northern Utah.
Okay, wow.
So I was seeing so many women coming from all over the place, who really just needed some help with their menopausal symptoms and knowing what to do and whether or not to take hormone therapy and all of those things. And what I was noticing was that the women who had, solid nutrition were following something along the lines of a Mediterranean style diet, who were not eating as much junk food, who were not consuming as much sugar, or unhealthy fats, all of these things we talk about now, which are pillars of brain healthy eating. I noticed that they had less symptoms during menopause and would also have just overall less severity in the entire perimenopausal period, less complications there, which. So I was a believer back then, before the data was coming out, that nutrition played a really important part. And that was an important part of my counseling.
Terrific. Thank you. And it just makes me think also, in this community, there are a lot of late 20-somethings, 30-somethings, women who may or may not be perimenopausal, but are thinking about it and considering it. And I think, in our conversation, as we get into brain health, it stands to reason that just sort of thinking about your symptoms in a global sense earlier will impact, hopefully, help you to have a sort of an easier time in your perimenopause.
Right. And for the younger women out there, think about if you've ever experienced, PMDD or premenstrual syndrome, premenstrual dysphoric disorder. I would have women at perimenopause come in and say, Annie, I feel like I have PMS all the time. And it's very, very similar, because the hormones are changing, they're fluctuating. It's not always predictable, which makes it harder. And it also changes, your appetite and your energy level and your thinking skills, and all of these things get wrapped up. For someone who's in their 20s, teens, 20s, 30s, still menstruating, still cycling, this is something that, you maybe learn to live with, or if you're on an oral contraceptive or something like that, you don't really get the symptoms anymore. But then at perimenopause, women who are not on birth control pills or any kind of hormonal contraception, it's a lot what they describe. And so starting to manage premenstrual symptoms earlier in life is a really good training ground for for approaching the menopause and finding things that work for each individual.
Terrific. Thank you so much. Okay. We have a lot of questions on brain health, on cognitive decline, on eating to stave it all off. Could you first just sort of ground us and let us know what Alzheimer's is, what dementia is, if they are separate, if one is a disease, one is not a disease? What are we talking about here when we say Alzheimer's?
So dementia is the umbrella term for cognitive decline, which is usually related to age. The term age-related cognitive decline encompasses many, many things. So dementia is the umbrella term. Of all the people who have dementia, Alzheimer's is around 70%. So it's the most common type of dementia, and it's a specific disease. There are certain disease criteria. There are certain proteins that we can see on CAT scans and MRIs and things like that. There's certain specificity to this disease, which makes it a little bit easier to study than some of the other types of dementia. And Alzheimer's is just the most common. So it's forefront of everyone's mind that, we have this Alzheimer's sort of epidemic looming due to our aging population, aging being the greatest risk factor for Alzheimer's. So beyond Alzheimer's disease, there are other types. Vascular dementia is another big category, which makes up possibly 20 to 30% of all dementias. But here's the thing, there's a lot of overlap between Alzheimer's and vascular dementia. One study showed that as many as 50% of people living with people with Alzheimer's also have vascular dementia. And vascular dementia is just the result of a cardiovascular system where the tiny arteries, especially in the brain, become damaged and blood flow to the brain is compromised. And then there are other types of dementia, of course, such as Lewy body dementia, such as temporal global lobe syndrome, such as the type of dementia you get from Parkinson's disease. There are a few others, but in our world, this is happening globally. This is happening in the US. Alzheimer's is the one that is getting most people's attention and most of the research.
Thank you for that. That's incredibly helpful. How does it appear? And we're talking about Alzheimer's now. Also, am I pronouncing it correctly? I realize I'm here. It's just such a silly question. I'm saying Alzheimer's and you're saying Alzheimer's. Maybe not a big deal. But
I think it's a regional difference.
Okay.
I say good. Alzheimer's. Yeah.
Okay. Appearance, manifestation, how do we know it's present, perhaps early?
Yeah, so Alzheimer's usually happens to people over the age of 65. But as I'm sure you've read, and if you've seen the movie Still Alice, you've learned that there's an early onset Alzheimer's too. So I would divide it in your mind into two separate diseases. Early onset Alzheimer's, which afflicts people in their 30s, 40s, and 50s. And late onset Alzheimer's disease, which afflicts people generally over 60 or 65. Okay. And the reason there's such a big distinction between these two is, number one, the late onset Alzheimer's is the most common type. It's over 98, 99% of the Alzheimer's in the world. Okay. The early onset type, a lot of people think of, and it's different in terms of how it presents because it's a genetic disease. And it comes from having an autosomal dominant gene that you get that goes in pretty much every generation. So you've probably read about, there's families in Colombia where they have early onset Alzheimer's, and then they have members in each generation have it. So this is the extremely rare, very unusual, less than 2% of all Alzheimer's cases that's being, intensively studied, because we know what the gene is, and they're trying to figure out how to modify that gene or otherwise help these families. Okay, very, very, very rare. So anyone who is concerned about having Alzheimer's in their 30s or 40s, 50s, even, highly unusual. Certainly go see a doctor if you're concerned, but this is not the norm. Okay, late onset Alzheimer's disease is, sometimes called the garden variety Alzheimer's, because that's what most of the people in the world are suffering with. And it starts to show symptoms in the 60s, sometimes 70s, sometimes 80s. Okay.
One of our community members noted that her father has the vascular type of dementia as a result of old strokes that he wasn't aware of. I imagine this is seen a lot.
Yes, actually, the older terminology for that type of dementia was called multi-infarct dementia. And, which is just kind of confusing to people outside the medical world, I think. But what it basically means is that people that had many little strokes, the blood flow to the brain would be compromised to the point where it would impede their memory and thinking skills.
Okay, thank you for that. On that, and really sort of circling back to your incredibly helpful description of sort of how it appears and how it manifests. If we're seeing someone, what might we look for in someone in their 60s, late 50s, who perhaps has had a series of strokes, so that might sort of present in a certain way. But and for those who have not had a series of strokes, what are we seeing?
Right. So this comes down to the issue of what's normal for aging and what is actually something that could be Alzheimer's disease. And it's not that easy to tell sometimes from the outside, but if you talk to a person, they may be able to help. So for example, when I was taking care of a lot of menopausal and perimenopausal women, every single day I would hear, Annie, I feel like I'm getting menopause. Yeah. I mean, I feel like I'm getting Alzheimer's. I can't remember anything. I can't remember someone's name. I can't remember dates. I can't remember. I look at numbers on a balance sheet and they don't make sense to me. Okay, so this is not usually Alzheimer's disease. This is memory impairment secondary to other things, such as lack of sleep or anxiety, or even untreated depression, or even just extreme stress from having, overwhelming menopausal symptoms like hot flashes and not feeling like yourself and being tired all the time. So that can really erode at your memory, but it doesn't mean that you're going to get Alzheimer's disease. It just means that you have, a cognitive problem that needs to be addressed. Okay. So 15% of all memory problems are called mild cognitive impairment, and they can be reversed. Okay. So anxiety, depression, sleeplessness, those are the low-hanging fruit. If you're in a younger age group and you're suffering from memory problems, alcohol is another big one. Alcohol use disorder. How it's hard to remember someone's name at a cocktail party when you've been also drinking.
Yes. So
alcohol
interesting.
has a huge impact on memory in the brain. We cannot deny it, and it also impacts the quality of sleep. So it's kind of like a double whammy for perimenopausal women. So first thing to know is, like, in your 40s and 50s and 60s, these memory problems are probably not Alzheimer's disease. They're very much more likely to be something else. Now, if you have a family member who you feel like is having some cognitive problems, there's a difference between forgetting where your keys are, or forgetting a date or someplace you're supposed to be, because that happens to everybody, because everybody's extremely distracted in our day and age. And most of these memory issues are from not paying attention or from multitasking, which we know is really bad for the circuitry in our brain. But if your family member is getting really confused, that is a key thing. Like, for example, I'll give you an example with my mom. Okay. And this was 10 years before she was diagnosed. This was in her mid 60s. Okay. Before we had diagnosed her with Alzheimer's disease, before the doctors had diagnosed her. She was never really good at directions, right? But she would never get overtly lost.
Mhm.
And I was coming home from, I think I was in residency. She picked me up at the airport. She's lived in the city for 30 years. She picks me up at the airport and I said, can we go shopping before we go home? She said, sure, let's go to the mall. And so we're driving to the mall and she pulls over on the highway because she can't remember how to get to the mall.
Hmm.
Now, what do you do if you're someone who just forgets, where they're going? You have your problem solving sets in, right? You look at your phone or you have a map, or like in olden days before iPhones, we would pull over to a gas station and ask someone where we are. But someone who has memory impairment that's pathologically caused by one of these diseases, they just honestly are just confused and they don't know what the next step is, the next logical step. So that is a clue, not just the getting lost or the forgetting things or forgetting names. It's really just being confused about how to figure out what the next step is. That's typical.
That's so helpful, Dr. Fenn. And I want to interject here a question that came in from a community member into sort of the back office of the community. But I think just to sort of go a little further into this would be really helpful. As you're speaking, I'm imagining many of us walking into our physicians' offices. I'm imagining you receiving patients into your office and this sort of like, this group panic around what's happening with us cognitively, which can feel really threatening. It's not, we tend to sort of make jokes about why did I walk into the room, or what did I mean to do, or where did I park the car? But it really can feel intense and worrisome, and framing the sort of confusion and that being another level to kind of look out for is really, really helpful. But I just want to read this question because this woman says that she'd like to understand brain fog and memory issues sort of more that she's experiencing. Interestingly, she said, I've never had issues with my memory before. How do you know when it's something more sinister and how to manage it? Now, this confusion piece sort of, and importantly, piggybacking off of that, the troubles problem solving when you're in the midst of confusion is a really great sort of red flag for us to have an awareness of. But for many of us in our 40s, 50s who are perimenopausal, maybe soon early postmenopausal, and we're sort of having these frequent, I can't remember, I don't know what I was doing, I am having trouble sort of like finishing tasks, things like that are getting in the way, or at least feel like they're getting in the way. Can you kind of like corral all of that for us?
Yes. So when that starts to happen, the brain fog that you're describing, or it's almost like sometimes your brain is just, the gears are spinning, and all of a sudden things just go to a halt.
Mm.
And it's that feeling like I could go to bed right now and it's the middle of the day. Like I could go lay down and go to sleep. Like that extremely overwhelming fatigue is sometimes part of it.
Yeah.
So when I was practicing perimenopause, no one really knew what to call this. Brain fog is a indistinct term that kind of came out of this that a lot of doctors don't really like because it's not very descriptive. But doctors have looked at this, and now what we understand what's going on is that when you're in perimenopause and menopause, the glucose metabolism in your brain is tanking sometimes.
Wow.
It's called a hypometabolic crisis. And it's been described by Dr. Lisa Mosconi and Dr. Roberta Brinton, who are two top researchers in this area. But what we're finding is that the fluctuation in hormones, remember I said it's like PMS, where your estrogen's crashing and your progesterone is like maybe non-existent. And, it's just wonky, from the balance is just not there. That can trigger less glucose uptake in the brain. And the primary source of fuel for the brain is glucose, which is the breakdown products of pretty much all the carbohydrates that you eat, which is incredibly important for having a brain that's humming along and working really efficiently. So I think a lot of menopausal women are experiencing, not the confusion part, but so much the memory loss, the like, where am I? What am I doing? The fogginess. And the first thing to ask yourself is, where am I in my cycle? Number one, did I get some sleep last night? Do I have anxiety right now? All of these simple things about your basic self-care. And all of this is completely pertinent to the status of how your brain is working. It's much more pertinent that rather than, whether or not this could be Alzheimer's disease.
Yes.
Which usually happens much later, but it's very fearful. And I've had many women come in every single day when I was in practice telling me they thought they had Alzheimer's disease because this happened or that happened. But that was never the case. It was always the fluctuation in the hormones, the glucose hypometabolism in the brain, creating this brain foggy state. That's really the cycle that's really hard to get out of because, when you're having hot flashes and you're not sleeping well, you wake up and you're not feeling well. When you're not feeling well and you're tired, it's hard to make good food choices too. Yeah. And then women tend to maybe go for more like caffeinated beverages to kind of perk themselves up. And then there's a crash from that. So there's this kind of vicious cycle going on where women are trying to take care of themselves, but they're just always sort of, chasing this sleep and chasing, the improvement of these symptoms. It's very, very difficult.
What you're making me think of too, Dr. Fenn, is so many of us start to have battles with our bodies. Perhaps they're, battles we've had since we were too young and should never have been worrying about it in the first place. But certainly perimenopause puts a new spin on it for many of us. And often what we understand nutritionally to do is to get rid of carbohydrates. And I can't tell you how many women I've spoken to just sort of like, anecdotally have said, oh, I just, I finally had some pasta and I feel so much better. Like my head cleared up, or I had some beans, or I had some fruit. I replenished myself with carbohydrates. And I'm wondering, I'm sure that comes up for you a lot. In thinking about sort of
people do all sorts of crazy things with their diet, because there's so much misinformation out there about what we should eat and how it affects our thinking skills and our, how we sleep and all of these things. There is some good data showing that how you eat can help you feel better mentally and physically. There's a ton of data about that. Back when I was a super, super busy OB doctor, and, at the end of patient visit, invariably someone would say, so Annie, what should I eat? Like, what's the best diet to eat? Yeah. And how pressured for time OB/GYN and other doctors can be. And I would keep a picture of the Mediterranean dietary pyramid in my desk drawer. And I would say, here, this is the best thing we know to eat. And you've all seen this dietary pyramid, right? I have it in my book. I can show you if you want. But this is still probably the best way to approach eating during the perimenopause. And now we have studies that show that following the Mediterranean dietary pattern can actually help you feel better if you're suffering from anxiety and depression. So the whole idea with, helping resolve and improve and sort of prevent that brain fog is to prevent glucose crashes from happening in your body. Okay. Mm-hmm. And so one way to approach eating during perimenopause is to eat foods with a low glycemic index. Okay. And does everyone know what that in this day and age, what that means? It's carbs are fine, but refined carbs are going to burn off so quickly and make your blood sugar skyrocket and go up and down and up and down and up and down, which we know is bad for thinking and memory skills and all of those things. So if you want to approach your diet like having blood sugar that's rock solid stable, that's the best way to do it. And the way to do that is with the foods that fill the Mediterranean diet pyramid, such as whole grains, such as legumes and beans, like you mentioned, vegetables, leafy greens, high fiber foods. Foods that are high in fiber are going to slow the absorption of sugar into the bloodstream. Like berries are one of the most brain healthy foods you can eat. And they do contain natural sugar, but they're also in this matrix of fiber. So they don't hit your bloodstream like sugar, and they don't make your brain feel like you just got a shot of sugar. So berries are extremely, important in terms of being a brain healthy and sort of a menopause friendly food. Dairy products are fine, but they should be without added sugars. one of the most important things people can do for their overall health and their brain health is to look at every single nutrition label of any food that they consume and make sure that there's no added sugars. Natural sugars are fine, in this matrix of fiber, but added sugars, they kind of hijack your bloodstream, and they give you too much blood sugar too fast, which overwhelms the pancreas and overwhelms, your body and leads to poor metabolic health. So these are really important things to start thinking about in the perimenopausal period that will help set you up for better brain health later, 50s, 60s, 70s.
Thank you. I want to come back to food and focus on that in just a few minutes. I just had a couple of other questions from people who reached out to me ahead of our call. One asked, are headaches and migraines at all related to future cognitive decline or future sort of putting people at risk of Alzheimer's disease?
No.
Okay.
It's not a significant risk factor. The Lancet Commission is a body of Alzheimer's experts that convenes every several years. The last time they put out an official statement was in 2020. And there are 12 identifiable, modifiable risk factors for Alzheimer's disease. Headaches is not one of them.
Okay. Okay, great. I feel, and this is my question, correct me if I'm wrong, I feel like I've heard along the way that dental care may impact cognitive decline. Is there any relationship there whatsoever between the health of your teeth?
There's some very interesting science going on showing that people with poor dental health, such as periodontitis, like gum disease, inflammation of the gums, can seed the brain with certain types of bacteria that are, that can definitely sort of add to the milieu of chronic inflammation in the brain in someone with Alzheimer's disease. It's not a big factor, okay? So, there's major factors in preventing Alzheimer's. There's nutrition, there's exercise. Those are the top two, right? There's sleep, there's stress mitigation, okay? It's healthy relationships. Okay, so these are the things that people should be focusing on. And then there's all these really interesting things that may be important. Of course, people should have great dental health and hygiene, brushing, flossing, extremely important. There is also a link between poor dental health and cardiovascular disease and also preterm labor.
Really?
So the seeding of bacteria from inflamed gums is something that we see in different organ systems, including the brain. But I think it might be helpful to think of Alzheimer's along the lines of, we don't know exactly what causes it, and there's probably not one cause. It's a multifactorial disease. And if there was one root cause of Alzheimer's disease, it may be chronic inflammation in the brain that happens over decades.
Okay. That's incredible.
So we know that when my mom was diagnosed in her late 70s, it's not like she just got Alzheimer's. We know that Alzheimer's was happening for 20 to 30 years before she started to exhibit obvious symptoms. Okay.
Yeah.
So I don't mean to say that to scare people like, oh, we're all getting Alzheimer's all the time. I actually flip it around and look at it from the positive way. This is a disease like cardiovascular disease that happens over decades. We have decades to impact our brain health later. We can take care of our brain in our 40s, in our 30s, in our 50s, all of these ages. We can implement some sort of brain health care that will actually prevent or delay, or maybe make it so that you never even get any problems with cognitive decline as an older person.
Yeah.
And the dental piece is like a little small piece of that.
Tiny piece. This speaks to the work that you do, right? And the education that you provide us all. So let's speak about the food specifically. You tapped into it already, sort of the Mediterranean diet as a nice umbrella to get familiar with. Certainly, if you don't yet have Dr. Fenn's book, please do get it. It's really wonderful.
Oh, thank you.
It really is. It's beautiful, and it sort of simplifies things that can get kind of unfortunately, I think sort of busy for us in our minds, not just because of kind of like the world that we live in and social media and all of that, but there are a lot of voices and chatter making sometimes things feel a little more complicated than they need to be. So with that, I think a lot about, when I think about what I'm going to feed myself with, I think a lot about this principle of eat the rainbow, because it just kind of, for me, simplifies what might end up feeling like a lot of information. So
Yes.
hit us with it. What should we be eating? And importantly, and not to be like food shaming or anything like that, but what should we want to eat less of?
Right. So it's important to know that this book, The Brain Health Kitchen, Preventing Alzheimer's Through Food, when I wrote this book, this is not my opinion on food and preventing Alzheimer's. This is based on all of the available data in the scientific literature at the time the book came out, which was earlier this year.
Yeah.
And I want people to know that, you know, we have so much science to show that what you eat really does matter for long-term brain health. So that's very reassuring. We're not guessing here. Like, we know that people that eat a certain way have less Alzheimer's later. Okay. So that's number one. That's very reassuring for anyone who has a family history of Alzheimer's like me, to be empowered that this is a guideline for taking care of your brain in the current time. And it's changing constantly, but this is the best way we know how to feed the brain now. So that's really, really good news. Okay. In 2015, when I started the Brain Health Kitchen as a cooking school, you know, as we were talking in the beginning, I was already doing healthy cooking classes in my community. I was teaching healthy Mexican, healthy Moroccan, healthy Mediterranean food. I had this one class called Desperation Dinners for like really busy people who work and have to come home and cook for their families. So I was already doing this work. I was working with my local hospital to teach cooking to prevent cognitive decline. And all of this is when my mom was diagnosed with the early stage mild cognitive impairment, which ended up being Alzheimer's. So this book was born when I started looking at my mom's diet and trying to figure out, okay, so maybe she has early Alzheimer's. Is that something that can be slowed down? Or is this just a trajectory, you know, that will have no impact with the way she eats or what she does? That was my number one question. And that same year, a really important paper came out called the MIND Diet Study, the MIND Diet Study out of Rush University. And this was a spin-off of the Mediterranean diet. Up until that point, we'd had probably a dozen papers showing that the Mediterranean style of eating that we talked about can actually prevent cardiovascular disease by reducing heart attack and stroke, and also prevent brain diseases like dementia and specifically Alzheimer's. We already had some data looking at that. And what the Rush University researchers did, Dr. Martha Claire Morris was the lead on this. She asked the question, what if you make the Mediterranean diet even more brain specific? And that's how she came up with the MIND diet. Because she, as a nutritional epidemiologist, she'd been studying certain food groups for 20 years already. She already had MRI data looking at people's brains on imaging to show that the more leafy greens you eat, like the more servings of salad you have in the course of a month, how better your brain looks on MRI. It basically looks lusher and younger and doesn't lose brain volume with time. So she already knew leafy greens was one of those brain healthy food groups. She had data on berries already. We had data from the blue zones, the 5 places on Earth where people tend to live to be 100 without dementia, that legumes and beans were a very important food group. So we had all these little pieces of information. And what she did was put it into the MIND diet criteria. And she created very elegantly, she and her team created 10 brain healthy food groups and 5 food groups to limit or avoid. And I thought this was such a brilliant model for a paper and also for a way to help people eat, that when I started writing my book, I thought, I'm going to write it about the MIND diet. And it is largely about the MIND diet, but it's about all the other science too. So what are the 10 brain healthy food groups? You probably can guess what they are, right? Berries is one, and there's criteria for how many servings a week. Leafy greens is another. Vegetables is a third. Nuts is the fourth. Fifth is legumes, you know, beans and legumes. and the sixth one is whole grains. So you see that the first 6 out of 10 brain healthy food groups are plant-based.
Yes.
And that goes along with the Mediterranean dietary pattern. These foods are high in fiber. These foods are like the eat the rainbow foods, right? And now we know in 2023, that means they're full of flavonoids. Flavonoids are the molecules in plant foods that make them colorful. They're plant pigments. Right. And the foods that have more of these pigments, more of these flavonoids, can protect the brain from decline. We know this. There's many studies that came out in the last couple of years to show that. It's very, very exciting. But the Mind Diet's not completely plant-based. So there's a couple more. They include poultry, chicken or turkey.
Yeah, yeah. I thought that was interesting. You talk about that food group a lot. And I thought, oh gosh, yeah, of course. I mean, I'm just thinking protein, but you frame it really well. Go on, I'm sorry.
Yes, it wasn't from a protein-centric point of view. It was more what Dr. Martha Claire told me years ago was niacin was a nutrient, a micronutrient that was emerging as a very important brain health nutrient. And poultry is super rich and dense in niacin. That was one reason she wanted to include poultry. The other reason is compliance. Her study cohort was almost 1,000 people in the greater Chicago area. These are middle to upper income class people of different races. And she was really concerned about just having them all go plant-based with some fish.
Sure.
You really need to have people stick to the diet through the 5-year time period.
Sure.
So poultry was included. And there's nothing particularly harmful about poultry as long as it's well sourced and good quality and consumed in small quantities. So poultry was included. The other one, of course, is fish and seafood. Everyone probably knows that fish is considered a brain food. The reason for that is it provides certain polyunsaturated fatty acids that your brain needs, such as omega-3s, fatty acids, DHA, and EPA. Now, these omega-3 fatty acids are so important because your body can't make them. There's certain nutrients your body can make, and there's others that your body cannot make. And you cannot make DHA and EPA. You have to consume it through your food, and you get this through fish and seafood. And DHA and EPA actually helps build the neurons in your brain. Your brain is not a static organ. There's brain cells that are constantly sort of dying off and other new ones being made. There are older brain cells that need to be repaired, and DHA and EPA actually become part of the brain cell membranes. They're absolutely instrumental in healthy brain aging. So fish and seafood was a very important food group. So those are the 9 food groups. The 10th one is red wine.
Yes, this blows me away because we hear it and then we hear it, oh, watch your drinking. Yes, you can have some of this, but not some of that.
Well, keep in mind, the study came out in 2015. It was just updated.
Okay.
The Mind Diet Part 2 came out last month. Was just presented at the Alzheimer's Association International Conference. But back in 2015, based on the Mediterranean diet, based on study of people in blue zones and how they age successfully, they opted to include a small amount of red wine. And I mean small. The limit is 5 ounces a day, and that's about 1/3 of a glass of red wine a day.
Yeah, it's nowhere near what people typically, drink or enjoy with a dinner or something like that. Yeah, that's so important.
Since then, here we are in 2023, we have a lot of data to show that there's no amount of alcohol that is beneficial to brain health and brain aging. And it's highly variable depending on the person who consumes it. And also people in Mediterranean countries and people in blue zones, they don't drink like people in Western societies do. I don't know anyone who
don't drink like they do in my suburb, that's for sure. They throw it back here.
I mean, I've visited blue zones. I've gone to Sardinia, to the, tiny, the island in Italy, and these tiny towns where they have the most centenary men in the world. And I see how they socialize, and they are one and done. Like they go down to the bar, they laugh, they tell jokes, they're socializing. They have, like a juice class that's half full of wine. They drink it, and then they go back home and have their minestrone soup with their families. It's completely different than the way Americans drink, and most people drink. So I think that in that culture, it probably does contribute to the longevity. In our culture, we're seeing only negatives.
Yeah.
And a big study that came out of the UK Biobank last year or 2 years ago now, looked at brain volume over time based on what people consume. You know, for example, if you eat a lot of red meat in your diet, does your brain, you know, shrink at a faster rate as you get older or not? Now, everyone's brain shrinks a little bit with age. It's kind of part of the aging process, right? It's sort of like height. You know, I might have been 5'2" when I was 19,
Right.
and it inevitably, you know, how much I work out or how much calcium I consume,
Yeah.
I'm going to lose 1/4 of an inch or 1/2 an inch, you know, by the time I'm elderly, right?
Right.
It's the same thing with brain volume. So the thing that, you know, scientists look at is what is the rate of decline of the volume of the brain. And what they found with alcohol is that what we used to think was moderate drinking, which is 1 drink a day for women, 2 drinks a day for men. We used to think that was kind of maybe healthy or healthy for some people. We found that the brain actually shrinks faster if you're consuming that amount of alcohol. And the cutoff seemed to be somewhere around 4 drinks per week where they started to see that decline.
Right.
Yeah.
That's amazing.
So importantly, that 10th food group was dropped in the Mind Diet trial that just came out. But you'll see it in the Mind Diet criteria. Now we should talk about
Terrific.
5 foods to limit or
Please.
avoid,
Yeah.
because these are really, really important. And these are extremely important for women in the menopausal age groups, okay? Because I think these are the ones that can hijack your symptoms and make you feel extremely worse than you have to feel.
Sure.
So the first one is fast and fried food.
Okay.
And the Mind Diet guidelines would like you to not consume fast or fried food more than once a week. So less than 1 serving a week, which is basically no fast food.
Yeah. All right.
And the reason for that is that these foods are basically ultra processed foods that are high in saturated fats and sometimes high in man-made fats, and which are especially detrimental to brain health with age. Okay. The brain healthy diet is not a low fat diet by any means. And I would never recommend a low fat diet to someone, but it's rich in monounsaturated fats, like you get from nuts, like you get from fish and seafood, like you get from olive oil and avocados. But it's very low in saturated fat, like you get from red.
Thank you for pointing out that distinction. That's so important. One fat is not the same as another.
Exactly. And as you know, I go into that in detail in the book because it's so important. I consider certain fats brain friendly. And other fats, I'm not going to call them bad.
Yeah.
But, you know, you should have some of them in your diet, but the brain healthy diet is very low in saturated fat, somewhere around less than 5%.
Incredible.
Okay. So fast and fried food, we all know what that is. We all know what that is. Okay. Number 2, red meat.
Okay.
Under 4 servings a week.
Okay.
Now these are guidelines, right? You don't have to eat any red meat, and you can be perfectly brain healthy. But they found that red meat, because it is so, you know, satiating, it mostly is higher in saturated fat than other forms of protein, that, you know, that contributes to the overall saturated fat content of the diet. Okay. So under 4 servings of red meat. So you don't have to be a vegetarian, you don't have to be a vegan. You can certainly, you know, choose meat if you like to, and just choose very high quality meat and eat less of it.
Sure.
A portion size is 3 ounces, which is about the size of a deck of cards.
Okay.
Not your typical American
Not
steak.
your typical. Thank you. Go ahead.
Yes. Okay. The third one is cheese, which I know a lot of people are going to be very.
This was a bummer. Yeah.
But the cheese guidelines are pretty austere, you know, for a dietary pattern that's really just, you know, not so strict, but less than 1 ounce a week is what the original Mind Diet recommends. Now, the reason for that is that cheese is high in saturated fat. And most Americans do not eat cheese like people in Mediterranean countries do.
No.
We're not eating artisanal cheese. It's got probiotics. It comes from sheep and goat. And having a small wedge with a piece of fruit for dessert. You know, the American way of eating cheese is more like the big bag of shredded cheddar that you have in your refrigerator at all times, so you can make a quick quesadilla.
Yeah.
And that's the kind of cheese intake that should be cut out, because it doesn't provide a lot of nutrients, and it provides a lot of these, you know, more, you know, detrimental types of fats. Okay. The other one is butter. less
Okay.
than an ounce a day. That's like less than a pat of butter a day.
Hmm.
And, the reason for that, oh, I left out one of the 10 brain healthy food groups, which is olive oil. The
Olive
reason for
oil.
that is
Yes, of
olive
course.
oil should be the primary cooking oil in a brain healthy diet. And when you start shifting from using butter for your baking, for your cooking, for flavoring your meals to olive oil, it's a really easy shift, but it's one that's sometimes hard for Americans to make.
Yeah. Thank you.
Butter also high in saturated fats.
Okay.
And the fifth one is pastries and sweets. And I'm not talking about like the whole grain chocolate chunk cookie I have in my book, which is made with buckwheat flour and olive oil and uses tahini instead of butter. It's like got all
Yeah.
these
Yeah.
nutrients in it, and dark chocolate, which has some brain health, merit. What we're talking about is packaged pastries and sweets, the things that you buy at the grocery store, the things that are ultra processed, the things that are high in sugar, low in fiber, devoid of nutrients, and just sort of this filler in our diets.
Yeah.
But the Mind Diet says, it's not like you don't have to give this up entirely. They're saying consume less than 5 servings a week. So if there's
Yeah.
a cookie that you like at a bakery, you can get that cookie and treat yourself. The things I would avoid in a brain healthy diet are, say, muffins you buy at the grocery store, right?
Yep.
Boxes of cookies. I would put crackers in this. There's some really good crackers, but most of them are refined flours, unhealthy fats, a lot of salt. Yeah.
I know we're going to close in a few minutes. I just wanted to ask one more thing, because you mentioned olive oil, which is like the thing. And I've definitely dialed up my intake since I started reading your book. But I'm hearing the lists of sort of like the most beneficial and the least. And I'm thinking also about how we prepare these foods and how important it is to our brain, how our food is prepared. And so olive oil is something to be cooking with. Should you cook, most of the time in your kitchen? Avocado oil, coconut oil, those things are also really popular in quote unquote sort of wellness conversations. Are they okay in terms of brain health, or should we really be sticking with olive oil as much as possible?
Well, I would use olive oil for most of your cooking. And this is another piece of the puzzle that you just brought up. We should be cooking our food more gently and at lower heat.
Okay.
Because when we apply high heat to food, especially proteins, it can really create inflammatory products that actually pass the blood-brain barrier and get into the brain. These things are called AGEs, or advanced glycation end products, AGE. And they deposit in brain cells, and they've been found to accumulate in the brain cells of people with Alzheimer's disease. So one thing we want to do is to avoid searing our food, frying our food, throwing our food right onto a hot grill. So these gentle cooking techniques are really important. And for these, you can use olive oil most of the time. It has a smoke point of around 350 to 375. And you can bake with it. It's part of my cookies and cakes and whatever my baked goods are. If you really want to cook something at a higher temperature, I recommend avocado oil or a nut oil, like pecan. Avocado oil, pecan oil. Other types of nut oils get kind of expensive, so I don't tend to recommend them a lot, but avocado oil is easily found. Now, there's other oils that you might want to use occasionally in your cooking, like coconut oil, because it has this lovely flavor. And I have a turmeric and black pepper granola in the book that I use coconut oil with. But it's probably the only recipe that I use coconut oil for. The problem with coconut oil is that it is 94, 95% saturated fat. So if that is a big part of your diet and your primary cooking oil, it's not healthy for you. It's actually the opposite. It raises LDL cholesterol. We know that it can raise it by as much as 10%, which translates to increased risk of Alzheimer's disease. Our blood cholesterol is an extremely important marker for whether or not we get Alzheimer's later or not. We want to keep our LDL cholesterol super, super low throughout midlife and beyond. So we don't want to consume foods every day that would bump that up. Butter, cheese, coconut oil is right in there with them.
Okay, terrific. Thank you. Dr. Fenn, finally, may I ask, how is your mom
Oh, thanks
doing?
for asking. She's doing well. She still lives at home since her diagnosis 8 years ago. One of my brothers lives with her, and it worked out really well that he was able to move into her house, and he's been there as her primary caregiver. And we have other caregivers coming in. It was just really until earlier this year that she started to veer into more moderate to severe Alzheimer's disease. But she can still, walk around the house by herself. She can make herself toast. We don't let her cook, but she can
Sure.
do simple things like put peanut butter on whole grain toast. She has been eating from the MIND diet specifically since her diagnosis. The first thing that I did was go in and clean out all of the ultra processed foods, all the unhealthy oils, all the unhealthy fats from her kitchen. And she eats berries, and she eats fish, and she eats whole grains, and she eats nut butters. And, she's been on this diet ever since. And I don't know if it's helped slow the decline. If you look at studies of people with early Alzheimer's, putting them on a MIND diet or a Mediterranean style diet does help slow the progression of the disease. So that's very reassuring.
Yeah.
But she's doing okay. We're actually looking at memory care centers at this point. She needs more care than what we can
Sure.
really provide at home.
Sure. Thank you. We wish
Yeah.
her well. And Dr. Fenn, finally, you have, as you mentioned at the beginning of the call, or maybe you didn't mention it, but I was thinking about it when you spoke about having gone really around the world, to Italy and various places in Europe and in Mexico, and you have programs, yes, that you invite
yes.
people to, and they can embark on with you, learn how to cook in the place that you're going. Are you going to Puglia, Italy? Is that?
I am going to Puglia.
Yeah.
Yes, I have brain health retreats. I have a lot of resources for your audience. If you
Great.
want to learn more about brain health, you want to take a deep dive into it. One is the brain health retreats that I offer. I travel all over the world, as you said, teaching cooking. The brain health retreats are a little bit different. We're going to Sicily next month, and what we do is we take a deep dive into the Mediterranean lifestyle. And every day we learn something new about what makes this culture so healthy. We'll visit an olive oil farm and learn how olives and olive oil are such an important part of the culture. We visit a place that makes cheese, and we learn why the cheese is so different there than what we consume in the US. And how do we seek out like the highest quality, cheeses? We just try to spy centenarians and see how they're moving naturally throughout the day. All of these things. We do take some cooking classes, and I do some teaching. But every day we have a different theme based on the pillars of the brain healthy, prevention diet. So I have Puglia coming up in the spring. I teach at a cooking school in Mexico at Rancho La Puerta twice a year. I'm always in the US, visiting. I just got off my book tour, so I'm a little bit on hiatus now, but I travel a ton, teaching cooking and giving talks. The other resource I have for people is I have a newsletter called Brain Health Kitchen on Substack. So it's brainhealthkitchen.substack.com. So this is an intimate community where you can come and read my newsletters. Every week I'm writing twice about the latest studies, and I'm also coming up with new recipes because I still love to cook, and I'm still spending a lot of my time creating recipes. So there are a lot of recipes on the Substack. I have a series of articles coming up about HRT and dementia, about the latest studies, and putting them in perspective with some of the other studies that we have. And then I also, if you want to dip your toe into brain healthy cooking, you can go to brainhealthkitchen.com, which is my website, where there's over 100 free recipes to look at. You can also find me on Instagram at Brain Health Kitchen.
Thank you. Dr. Fenn, if you can indulge us just for 5 more minutes, a question just came in. What about the ketogenic diet for brain health?
Yeah, the ketogenic diet is interesting, and it's very confusing for people because researchers are looking at the ketogenic diet to see if it can help Alzheimer's victims think better. Okay. So remember we talked about glucose metabolism in the brain at menopause? Okay. Fast forward, someone who has Alzheimer's disease, they no longer respond to glucose as their primary source of fuel.
Okay.
It's one of the problems with the brain in Alzheimer's disease. They no longer can access glucose, which is our primary fuel, but they can access ketone bodies, which is
Okay.
an accessory fuel used in times of starvation. Like when our body goes into hunger mode, like people on ketogenic diets fast for long periods of time. So researchers are looking at Alzheimer's patients saying, what if we give them ketone bodies like MCT oil, or put them on a ketogenic diet, or do both? And some of these studies have been actually very positive in terms of short term, it improves their thinking skills and their memory, which is really great news, that some people with Alzheimer's may do better on a ketogenic diet. We don't know this for sure, but we've got some positive results. Now, does that mean it's good for prevention?
Right. That was
But
my question.
preventing Alzheimer's is a completely different ballgame than treating Alzheimer's disease, because you've got a brain that's riddled with certain proteins that causes it not to function and causes it not to access glucose anymore. But if you have a healthy brain and you're trying to prevent Alzheimer's disease, the main problem with the ketogenic diet is it's too limiting in food groups. You know,
Yes.
we went over the brain healthy food groups, and it's really important to hit the servings that's recommended. This we know based on that Mind Diet study, which I think I mentioned, reduced Alzheimer's by 53%, the people that followed it most closely, like 53%.
That's amazing.
We don't have any drug or
incredible.
any intervention that has been that successful in terms of reducing the risk of getting Alzheimer's. So I think that's really where the money is. You don't want to give up beans. You don't want to give up whole grains. Definitely give up refined grains. And a lot of people in ketogenic diet studies that do better in terms of their health outcomes, they're giving up a lot of ultra processed foods, and like white bread and white rice and, you know, ultra processed foods in general, which I think is part of the health outcomes, which is great. Everyone should be giving up those foods. But the whole grains, the beans, are foods that are high in fiber, that slow glucose absorption. They lower cholesterol. They're a really important part of Blue Zones diets. And I wouldn't skimp on any food groups. I would make sure that the diet is absolutely as diverse as can be. Another piece of this puzzle that we didn't get into is the gut microbiome. You know, a lot of what we're learning about brain health comes from what we're learning about the gut. And we know that to have a healthy and diverse gut microbiome, that means feeding the trillions of microbiota that live in your gut. They require a diverse diet that is based on a lot of plant foods and a lot of fiber. So my only problem with ketogenic diet, I think fasting has some brain health benefits. I enjoy intermittent fasting myself. There's some good studies to show that it helps wash out, you know, maybe toxins in the brain at night if you're giving your body a long break from eating. But I wouldn't do a ketogenic diet that's so rigid that you're not getting the food groups that your brain needs to thrive.
Interesting. I always think about ketogenic diet and sort of the ease with which people sort of waver into this dirty keto. So maybe you start eating like a lot of bacon or a lot of eggs or things that you're sort of not understanding how the ketogenic diet should really work. You do understand to omit carbohydrates, refined carbohydrates, right?
Yeah,
and
it's hard to do it. It's hard to do it well. Have
yeah.
balanced, you know, nutrition. It's like your body can thrive on fats for a long time, but in the end, it gets starved of the micronutrients that you need. And so ketogenic can be good for someone who's trying to lose weight, or some studies show that if you have type 2 diabetes, a short-term ketogenic diet pattern can be part of the treatment to reverse the diabetes. But as soon as you get back down to a weight loss goal that's really healthy, I would switch to the Mediterranean or the Mind diet or something along those lines.
Dr. Annie Fenn, thank you so much for this hour plus. You've just been a delight to speak to, an enormous resource, a wealth of information. You've threaded the needle between perimenopause, menopause, premenopause, and brain health just beautifully. Thank you so
Thank you for
very
having
much.
me. It's such a pleasure to
pleasure.
speak to this community and to get to know you too, Rachel. Thank you so much.
Thank you everyone who came, and we will talk again soon, I hope.
Okay, keep in touch.
Good, very
All right,
good.
take
Best
care,
to you.
everybody.